Hi, my name's Laura Henderson and I'm one of the nurses here at Margaret Sparrow Clinic in Wellington. And today I'm going to run through what happens when you come to a family planning clinic to have your cervical smear done. So first of all, you'd come into the room and you'd sit down with one of our female nurses, and we might ask you some questions just about your general health, about your sexual health. We might ask you some questions around contraception and just get an idea of where you're at. We'd also talk about whether you've had your Gardasil vaccination, but again, having cervical smears every 3 years is still going to give you the best protection against cervical cancer. So once we've done that, we would start to talk a little bit about the procedure. And to have a cervical smear, what we do is we use a speculum, which looks like this. We put this inside your vagina to get a really great look at the very bottom part of your uterus, which is called your cervix, which is where we want to take the sample from. So this is the speculum. As you can see, it's quite small, and you've got the option to insert the speculum yourself as well. So you can pop it into your vagina, or one of the nurses can do it for you. Once the speculum is inside your vagina, we will open it up just really gently and softly and get a really great view of that cervix. Once that's done, we're going to use a brush like this to put inside the speculum and to take some samples from around your cervix. It tickles, or it can feel a bit uncomfortable, but it shouldn't be sore. We may also use this time just to take a few sexual health swabs as well, if that's also what you'd like or what you need. The brush is nice and soft, and as you can kind of see, it's soft and bendy, but it's a really great brush for getting a great sample from all around your cervix. So what I might ask you to do when you come in is to, after we've done the chat, we've talked about how we're going to take the smear, is to get you onto one of our beds. So I'll show you what the bed looks like. There's always a light at the end of the bed, just so we can examine you properly. At this point, you may turn off the light and let you get changed in private, which is always a nice option. And you would put your bottom up onto the bed here and cover yourself with the blanket. We'd ask you to take your underwear and your tights off, or pull your dress up, or take your pants off, but you can leave your socks on, that's fine. And then we'd close the curtain and make you as comfortable as possible, and then get started with the procedure. All the nurses and doctors who work at family planning are really expert in doing cervical screening, so I would have done well over 1,000 cervical smears since I've worked here, and a nurse who works full time may do up to 50 examinations per week, so you're in really great hands when you come to see a family planning nurse.